Hi, my name is Dr. Apazidis. I'm an orthopedic spine surgeon practicing at 57 and 7th Avenue in Manhattan, New York. So some of the most common procedures that we do in spine surgery are cervical discectomy infusions and lumbar discectomy infusions. Those are general terms for the procedures. I like to say that common procedures that we do are common for a reason. It's because they work. There are problems that we typically see in spine surgery practice, the typical types of problems that patients present with. And we tend to use the procedures that are most effective in terms of getting faster recoveries, getting rid of the problem, and getting the patients back to work and sports and family activities as soon as possible. The most common procedure is an anterior cervical discectomy infusion. This is a procedure where we replace the disc in the neck that is herniated and causing stenosis of the cervical spine or neural impingement. Symptoms include numbness and weakness of the upper extremities, the arms, neck pain, headaches. The procedure entails an approach from the front of the neck, a small incision in the front, and I always like to tell patients to not be concerned about incisions in this area because the skin heals very well. In 6 to 9 months frequently, you do not even see the incision. We also employ plastic surgeons to close the skin in these areas to achieve the best possible outcomes. The procedure on the anterior spine of the neck typically includes removing the disc, looking at the spinal cord, making sure that all of the herniated material is gone, that the nerve roots that are exiting at that level have been decompressed, or that there's nothing pushing on those nerve roots causing the pain, numbness, and tingling, and then replacing that disc. Sometimes it means replacing it with a fusion device, which is a small plastic and metal spacer that is meant to stabilize the spine at that level. Sometimes it can mean what's called disc replacement or disc arthroplasty procedure, where instead of putting in a plastic and metal spacer that's held there with screws or a plate, we employ a complete disc replacement system, which is a model of a natural disc. It moves like a natural disc. One other question we get is, well, are these procedures permanent? All of these procedures are permanent procedures. They are performed and that level is taken care of, and there essentially isn't any other problems once we've done either a disc replacement or a fusion. In terms of the lumbar spine, so procedures for the lumbar spine are in a way a little more complex than neck problems. Number one, they're more complex because you can approach the lumbar spine from the front, from the side, or from the back. And decisions about how to approach the lumbar spine have to do primarily with, number one, what is the problem in the lumbar spine? Where is the disc herniation? What is it causing? And how can we get to it the best way? It also has to do with patient factors. There obviously are certain increased risks or benefits of approaching the lumbar spine, whether it's from the front, from the side, or from the back. We'll review which approach is used and why with every patient, obviously, before any surgical procedure. Risks obviously always include the possibility of bleeding and infection, but these are minimized with the most modern techniques. The risks of neurologic issues also are minimized with intraoperative neural monitoring, as well as using the most modern instruments and implants that are meant to decrease the risk of any kind of neurologic injury. To find out more about orthopedic spine surgery or to seek a consultation, please go to my website, www.totalspineandsportscare.com.